Hello and welcome to part 2 of the Women in Concierge Medicine podcast, brought to you by Specialdocs Consultants. I'm Terry Bauer, CEO of Specialdocs. We've gathered 5 leading female concierge physicians for a panel discussion on why the concierge model has proven to be an ideal fit for them. It's a great resource for any physician considering a transition to concierge medicine. You can find the entire series on the News and Insights page of our website, specialdocs.com, or on any of the Specialdocs social media pages. What you're about to hear is part 2 of the podcast, where the doctors discuss how physicians and patients benefit from the concierge medicine model. Thank you for watching. There were a couple themes that came out of that last conversation that I'd like to mention to the group and see if you would talk a little bit about that. Really, it's the benefits to the patients. What have you seen with that? The benefits to you individually, and the benefits to those of you who have families. What have you seen in those 3 areas relative to your life now as a concierge doctor?
I feel that the patients leave my office feeling that all their questions are answered. Every patient who comes in for an office visit or a physical is left with an instruction sheet with everything written out that we had talked about so that there's no confusion. I feel satisfied that I did really good medicine and that I gave them the best care I could. As far as how concierge medicine has changed my life, I'm more satisfied. I don't feel as if I'm going to break by going to work. Even though some days can be long, they're very rewarding, and I know all my patients. And so even if we're on 24 hours a day, 7 days a week, if somebody calls me on the weekend, there are people I know. It's like an old friend. They've been my patient for over 15 years. And so sometimes it's not even like work. We can all do this in the middle of the night, any hour of the day in the grocery store. But it's nice when it's a patient that you know, and they're all my patients, and I'm not covering for a big group anymore. My family doesn't see me come home with a ton of charts. In those days, we had charts where I was documenting. They don't see me as anxious. When I come home, I'm home and I'm present. I have an overdeveloped sense of responsibility, and sometimes I look at my email too much and I respond too fast. You've even made comments to that when you email me at night. So that's my own doing. My patients don't expect it.
Who else would like to comment on the benefits to patients, the benefits to you personally, and the benefits to your families?
So, one thing on a day-to-day basis that I just have noticed is that, a year ago when I went into a patient's room, and this took a while to stop after I started concierge medicine, I was immediately trying to figure out how to get out of the room, because that's what you have to do to stay on time and to see 20 patients a day. So it took a while for me to sort of slow down a little bit. And it's sort of bled over into other parts of my life where I can feel a little more present, and I'm not always late and I'm not always anxious. So it's really been a truly positive experience. The patient, and I agree with Monica, the patients are happy. They get their questions answered. They get clear direction. They get responded to. They get validated. And hopefully we keep people out of the hospital more. I think that's part of quality care is good communication. So it's been a great thing so far. So I love it.
Any other comments before we move on to the next topic?
So I wanted to basically echo the sentiments of the other docs that have already spoken. I think that from a patient care standpoint, the way that I'm practicing now is excellent. It is a pleasure to be available to patients. When they come to the office, they know that, as the other ladies have said, before they leave, they get their questions answered. If they had another question, they can't remember what it is before they left, no problem. Just message us after. Just send me a message, call, send a text if you want. I have my patients routinely update me about what they're doing with their specialists. We kind of gather those records. So I think they feel very well looked after at all times. I've had patients say, I'm not going to call you after hours, Dr. Stern. I'm not going to do it. And I was like, it's okay. But if you need to, please do. Feel free to. And patients don't. They have a lot of respect for my time. And the few times that I have gotten really late night, overnight calls have have absolutely been appropriate, and the patients have been very appreciative that I've picked up the phone for them and I've been able to rescue them from situations that otherwise might have gotten their health in trouble. So I feel very good about the care that I provide, but much more than that, I think the patients feel really good that they have the peace of mind to know that I'm there if they need me. So it's definitely a win-win from a medical care standpoint on both sides.
That concludes part 2 of the Women in Concierge Medicine podcast. You can find the entire series on the News and Insights page of our website, specialdocs.com, or on any of the Specialdocs social media pages. Thank you for watching.